Gareth Davies.
Diolch, Gareth. It's a pleasure to take part in this debate this afternoon and to join my colleagues in calling for the declaration of a health emergency. And I'm keen to make the case for why the situation in our health service is an emergency and should be the Welsh Government's #1 priority. I'd like to speak up for my constituents, for patients, and as a former NHS worker, for our healthcare workers who are not just facing challenges. The Welsh NHS is in crisis. And in my constituency, that crisis couldn't be any clearer than in Glenclwyd Hospital. Glenclwyd now has the worst waiting times across the whole of Wales, and patients in my constituency are waiting hours in A&E and sometimes years for routine operations. Just this morning, patients at Ysbyty Glenclwyd A&E were waiting over 6 hours, and that's on a good day. Behind each of these statistics is a real person, and I hear harrowing stories in my constituency surgeries from patients at Glenclwyd Hospital. There are 790,000 pathways in Wales, with an eye-watering 200,000 of them being within the Betsy Cadwaladr University Health Board. The situation for children is equally dire, with 481 under-18s in Betsy now waiting over 2 years for care, part of the 1,016% increase in community paediatric waiting lists since 2018. We just cannot go on like this. The Welsh Government have declared a nature and climate emergency. We now need to declare a health emergency in Wales. Unlike the trendy nature of the climate emergencies championed by the establishment, this crisis lacks glamour, but demands urgent action and would mean more preventable deaths, prolonged suffering and eroded trust in the NHS. Real consequences for real people unfolding every day in our communities. Declaring a health emergency is an honest admission that the system is failing and that extraordinary measures are needed. This is about maintaining a level of dignity people expect of us. No one in a first world country should have to put up with waiting times Welsh people have had to endure under the Welsh NHS. And if we are moving in the direction, I may feel differently, but it's not. With 2-year waits up to 9,600 across Betsy Cadwaladr and almost 15% rise from the previous month. Declaring a health emergency is a sign that the Welsh Government cares enough to act, to put the health of the people before political convenience, and people are told time and time again that things will improve. The Welsh Conservatives have called for a maximum 1-year wait, fast-track surgeries, a 7-day GP service, new surgical hubs, a real recovery team supporting directly to the Cabinet Secretary. These are tangible steps that go beyond targets and more money. The Chief Executive of the Welsh NHS has called for a response on par with the COVID-19 pandemic, and I agree, because there is a crisis that needs a similar response. And as I do have time, I will respond to the comment made by the member for North Wales in the North Denbighshire Community Hospital, in that it's an absolute watering down of what the people of Rhyl and Prestatyn were initially promised over 10 years ago. And the member herself has been relatively silent over this matter for a long period of time, since it's been raised many times in the Senedd chamber. I will just finish my sentence. But then progress is being made, and now the Labour Party are trying to come up smelling of roses. But what the reality is the fact that what the people of Rhyl and Prestatyn were promised over 10 years ago has not actually been delivered, and the delay in actually building the thing itself. And I will give way.
The reason why it wasn't able to progress, because of inflationary costs caused by your UK Conservative government. There was no capital funding coming forward until the UK Labour government took power, and some capital funding has come across now to Welsh Labour government, making capital funding available. So I'm hoping that this window of opportunity is available to now push forward with the Alexandra Hospital.
When it was initially planned, it was a fraction of the cost. And if that hospital was delivered as promised at the time, it would remain a fraction of the current cost. Yes, inflation, of course, and price rises will always increase. Of course they will. That's the nature of the economy. But if that was delivered in 2013, 2014, as initially promised, they would have had that hospital, as promised, for a fraction of its current price. And that's the reality, and the Labour Party have failed my constituents in the Vale of Clwyd, and that's probably why he lost the seat in 2021.
The Cabinet Secretary for Health now to contribute to the debate, Jeremy Miles. Thank you, Hugh.
Ourselves indulging once again in the opposition's favourite sport, kicking the NHS from pillar to post.